I'm Diana Cave, Health Sciences and EMT instructor. Today I'm going to talk to you about successfully performing a scene size up, primary assessment, secondary assessment on an adult medical patient and be able to make an informed transport decision to an appropriate medical facility. So the first thing we do is, how do I perform a scene size up? You gather information prior to arriving at the scene, and that is from dispatch. The 911 call center gives you information, so you can go ahead and be making decisions based on the information that you're given. Prior to arriving to the scene and just arriving to the scene, you take in any considerations such as, are there hazardous materials? You look around, you do a scene size up. You look at the nature or the mechanics of the illness or the injury that you notice, and this is for a medical patient, so we won't get into are there any hazards such as hazardous materials and things like that. So this is just for a medical patient. So I'm going to approach the patient. I'm going to take the information that's given to me prior to reaching the patient, and then I'm going to actually start assessing the patient prior to actually reaching the patient and putting my hands upon the patient. So, nature of illness. I'm going to reach the patient with my PPE, personal protective equipment on, and then I'm going to be forming the nature of illness. How does my patient present? What do they look like? What does their color look like? Are they pale? Are they very sweaty? Are they diaphoretic? Do they look like they're struggling to breathe? All of these things are signs, things that we see before we actually even reach the patient, or things that we hear. Do they have noisy breathing? Things like that. So then I'm going to reach the patient and I'm going to introduce myself and say, hi, I'm Diana, I'm an EMT, may I help you? And then I'm going to assess them. If they're able to talk to me, that's the first thing, their LOC, level of consciousness. If they're alert and able to talk to me, then I know that they're alert. If they are able to talk to me, then that answers ABCs, airway, breathing, and circulation. So their airway is open. Are they making any kind of noise? Then I'm going to assess their breathing. Look, listen, and feel for their chest to rise and fall. And then I can also listen to breath sounds at that time. And then I will place my hands on their radial pulse to check their pulse. And with their breathing, with their respiration and their circulation, then we will note rate, rhythm, and quality. So now I will stop and demonstrate this on Trenton, and then we'll go and have the two students demonstrate it on each other and critique and practice from there.